Nobody wants to be in the hospital, and a new national study says there is extra incentive to stay out of them in this state. It rates New Mexico's dead last on its hospital safety scorecard. But the hospitals say that's baloney. Katie Kim has both sides in tonight's News 13 special assignment.
When something unexpected happens, we expect hospitals to provide safe, effective care. But an alarming new report suggests New Mexicans should be very concerned.
New Mexico ranks at the bottom of the country in terms of the percentage of their hospitals that are top-notch in quality.
If you do an internet search for safe hospitals, this will pop up, the Hospital Safety Score website. It's a nationwide report card that grades hospitals in areas like the number of injury cases from falls, medication errors, and deaths related to surgery complications. The scores are calculated by a Washington, D.C.-based nonprofit called the Leapfrog Group. New Mexico sits dead last on that list.
New Mexico only has one hospital earning an A, and it ends up being the lowest among the states in our database.
The only hospital to make the grade was Espanola Hospital. Of the 13 other New Mexico hospitals rated, more than half received a C, including the state's biggest hospital, UNMH. Roswell Regional Hospital got a D, the worst grade in the state.
We just don't think that the leapfrog analysis is a valid tool.
The New Mexico Hospital Association dismisses the Leapfrog report, saying its methods are flawed. NMHA President Jeff Dye says if you participate in the survey, Leapfrog gives you a better score.
That creates a bias in the data.
Dye points out most hospitals around the country, including the American Hospital Association, dismiss the Leapfrog report for being unfair. The University of New Mexico Hospital is among those critical of the study.
UNMH did not participate in the Leapfrog survey. In fact, Leapfrog says the Presbyterian hospitals in Albuquerque, Clovis, and Espanola were the only ones that voluntarily handed over data. Those medical centers received an A or B.
If you choose not to participate, they still grade you. As a consequence, we got a C score.
Dr. Mark David Monk heads up UNMH's Quality Control Division. He says the hospital has a team committed to reducing error, infections, complications, and the like.
Whether they're surgical safety programs, whether the medication safety administration programs, whether it's the simulation testing that we put our doctors, nurses, and technicians through, there's a wide range of patient safety activity taking place.
Leapfrog has their own methodology for giving out a grade. They take most of their information from federal data, which shows UNMH's complications from surgery is worse than the national average. But Dr. Monk says the hospital is in better shape than the Leapfrog report implies.
There are times when we fall down. There are times when we don't perform quite as well as we would like to perform, and that matters to us.
But Leapfrog officials stand by their findings, saying the group didn't favor hospitals that chose to participate.
Those that are criticizing the methodology don't tend to be the ones that get an A.
Are New Mexico hospitals safe?
We really believe they are, and we're getting safer.
On special assignment, Katie Kim, KRQE News 13.
And there's something else. The Leapfrog report surveyed only New Mexico hospitals for which public data is available. For example, Santa Fe's only hospital, Christus St. Vincent, is not in the report because their data is not public. The group claims 1 in 4 patients admitted to hospitals nationwide developed conditions that they did not have when they came in.